Stroke caused 6,99,000 deaths in India in 2019, which was 7.4% of the total deaths in the country, says a Lancet study last year. Stroke, headache disorders, and epilepsy are the leading contributors to neurological disorders burden in India, the report said. According to the Indian Stroke Association, the incidence of stroke in India increased by almost 100% in the past few decades. To shed light on various such issues, today we have with us Dr. Safal Shetty, Associate Consultant Neurologist, Manipal Hospitals, Panaji, Goa. Welcome, Doctor.
Thank you. Thank you so much for having me.
First, please tell us about the causes of stroke. Can a hectic lifestyle or too much stress be a cause, and when can stroke be fatal?
Yeah, so, it's a good introduction which you have given about stroke mainly. We know that as the time is going, the number of stroke cases also have been increasing. So, which is mainly because of some of the risk factors involved in stroke. So, before that, let us see what are the risk factors for stroke. Yeah. So stroke has mainly two types of risk factors. One is modifiable, another one is non-modifiable. So modifiable ones are like diabetes, hypertension, poor cholesterol control, and an entity called as obstructive sleep apnea, where a person has difficulty in sleeping and has snoring. Because of snoring, he keeps getting up, and that is also a risk factor, or a heart condition. Yeah. So heart condition specifically something called as a rheumatic heart disease, which can cause stroke. So how rheumatic heart disease causes stroke is that because of the rheumatic heart disease, the heart doesn't beat regularly. So the beating of the heart is irregular, because of which a clot can be formed inside the heart, and that clot can go all the way up to the brain and can cause stroke. Okay, so these are some of the important modifiable risk factors. So there are non-modifiable risk factors also. So one most important non-modifiable risk factor is the age. So we know that as we age, our chances of having stroke, even cardiac disease or heart disease or heart attack also increases. So that is something which we cannot change. We know that as we age, we are going to get diseases. Okay. So that is one. And there are some race of people, like blacks, are known to have higher chance of having stroke. So these two are some of the important non-modifiable risk factors, is what I would say. So these are the two aspects which we have to see from risk factor point of view in stroke. So modifiable means you have the chance to modify them. All right. So you can say that, if you're having a hectic lifestyle or your life is filled with a lot of stress, meeting deadlines, then obviously your chances of having diabetes, hypertension increases. Some people even to relieve the stress for that moment, they get into alcohol, they can get into smoking. So those two factors also come into a picture. So decreasing smoking, or even you have to quit smoking, and decreasing the alcohol intake also reduces the chance of you having a stroke. So stress causes an individual to have the diabetes and hypertension, and an individual can go into all these activities of smoking and alcohol, and also they will have sedentary lifestyle. So adequate exercises will help the person to reduce the chance of having stroke. So these modifiable risk factors, if you can take care, then you are having a lesser chance of getting a stroke. So I would definitely say yes, having a hectic lifestyle does have an impact on getting stroke.
Okay. And what are the symptoms that our body signals that we should not ignore? And is it possible to prevent a stroke? And who is at most risk? You have already mentioned a few things still.
Yeah. See, one thing is that we can look at this, the symptoms from two different points of view. One is if a person is already having a stroke and he has just noticed to have some symptoms. Okay. Let's say half an hour back he was all right, and since half an hour he has some history of having difficulty in walking or difficulty in speaking, or there is deviation of angle of mouth to one side. So that means that the stroke has started. Okay, it has started. So you have already been having the stroke, and at this point of time, it becomes important for an individual to go to the medical attention within 4.5 hours, as early as possible. So here we see something called as window period. So a person who is having this stroke, who is at the onset only, if he goes to the hospital within 4.5 hours, then we can give an injection which will help to reverse the symptoms. Okay, so it becomes important for an individual to go into the hospital at the earliest, so that the injection can be given. Again, there is a checklist for the injection, whether who should get it, whom it cannot be given. But irrespective of that, it's an individual's priority to go to the hospital whenever the stroke is started. So ideally, it has to be within 4.5 hours. Okay, that is what I would like to say. Now let's look at it from another point of view of preventing the stroke, right? So if you are having uncontrollable diabetes, uncontrollable hypertension, and you are smoking, these are all the symptoms, or these are all the signs which the body gives that your health is going towards different or wrong direction. So in that case, you'll have to start modifying those things, like whatever we discussed about modifiable risk factors. So if you take care of those risk factors, so you start, if your diabetes is going out of control, then you know that your chance of having a stroke or a heart attack is going to be there, so you take care of that. If you're having hypertension, and you know that constantly your BP has been on the higher side irrespective of being on medications, then you need to take care of that. Go see the general physician, take care of the BP. If you are smoking, if you are having a sedentary lifestyle, then you know that these are the signs which the body will tell you that your chances of having a stroke is going to be there. So you have to change your track, go towards healthy lifestyle, quit smoking, quit alcohol, maintain a healthy lifestyle of doing 30 minutes of regular exercise for 5 days a week, take care of your BP, take care of your hypertension. So chances of you having a stroke will be lesser. So this is how body gives an indication that the chances are there when it has not yet occurred. But when it has occurred, then it is that window period which we discussed of coming to the hospital within 4.5 hours.
Yes.
So that's how I would like to look at it. Yeah.
Okay. How long does the recovery take, and what precautions should we take after a stroke attack?
Okay. See, but the recovery from stroke is dependent on three things. One is about the site where the stroke has occurred. Okay. So the site, what I mean to say is that if the site is in the brainstem, all right, where all the fibers from the brain, from the top of the brain, is coming down to one area, and it is going through that area. So the area is small, but the area is very important. So if that area is damaged, then your chances of recovery is going to be lesser. Okay, so the site becomes important about recovery. Next is how big is the stroke. All right. So if at all a stroke is bigger in size, then the chances of the person coming out or recovering will take time. Okay. So if a stroke is smaller and it is in a site which is not in the brainstem, then you have a good recovery. We're going to have a good recovery. Next, third thing is what is the type of stroke the person has had. We divide stroke into hemorrhagic stroke, which means there is bleeding in the brain, and we divide the stroke into ischemic stroke, where the blood vessel which is supplying the brain tissue, it has got a clot, and because of which the adequate supply has not occurred. Okay. Hemorrhagic strokes, if the size is smaller, then the recovery is good. Ischemic stroke, where the size is smaller, then the recovery is good. All right. So, but if both the sizes are small, the hemorrhagic stroke is going to be better recovering than the ischemic stroke. Okay. So these are the three aspects: site, size, and the type of stroke also matters. Yeah.
Okay. So these days we hear more about Alzheimer's disease and Parkinson's disease. How can we spot symptoms, and how can we manage people with such conditions?
See, Alzheimer's and Parkinson's are two neurodegenerative diseases, which means that moment we use degenerative, it means that the disease is going to increase. or the course of the disease is going to be progressive. So day by day, the symptoms are going to increase. Though it takes different time periods for the symptoms to increase in two diseases which we are discussing. So Alzheimer's is basically a type of dementia where the cognitive abilities of an individual starts decreasing, mainly in memory. Okay, the short-term memory, that is mainly, the where the person has what the person has had for breakfast, he forgets, or he keeps asking questions for the questions for which answers have been already given.
Hmm.
Okay, so this is the memory problem which he has. So Alzheimer's is that where there is a person who has loss of memory, mainly with respect to short-term memory. So as I've already told you, what are the types of memory problems the person comes with. Gradually, the memory problem will go into difficulty in finding ways, which is in a different site of the brain, and then it goes towards the language, unable to speak out, unable to understand what the other person is speaking to you. So it progresses like this. Eventually, it involves the whole of the brain, where the person forgets the close relatives, forgets themselves, and has no idea, and does not have an identity. Okay, this is what eventually it leads to. So we know that it takes some years for this state to occur. Now Parkinson's, on the other hand, starts initially with tremors. You
Hmm.
know, tremorlessness of the hand. So it is usually one-sided, either left or right, and person will start having tremorlessness mainly while sitting, and while walking someone else notices that his hand is trembling. But initially the tremorlessness will be there only while person is sitting or at rest, but not while doing any activities. So he does not have any problem while doing activities.
Hmm.
Mainly people come to us at the early stages of Parkinson's disease because someone else has noticed it, or it becomes difficult for them to engage in a social um, place because their hands are trembling. So they are little shy about that. So they don't want to get into any social functions. So now that is how the Parkinson's patient comes to us, mainly with tremorlessness of the hands. There's another way in which they can come. Another way is where they have difficulty in moving one side of the body. Okay,
Hmm.
and it is not sudden in onset; it is gradual. They know that they're able to walk, they're able to use that particular side, but they feel one side is somehow slower compared to the other side. That's how they come with. So these are the two ways in which a person comes to us. Common one is the tremors. Second is the slowness of one side of the body. Yeah, slowness, or they feel right side is not moving as quickly as to the left side. When they're walking, they feel right hand is not swinging as good as left side. So this is how they come. So Alzheimer's and Parkinson's are two different types of diseases, though both of them are neurodegenerative disease. Yeah, this is how you can spot the symptoms. Alzheimer's is mainly memory problem. Parkinson's is tremors and slowness of one side of the body.
Hmm. Okay. And what causes multiple sclerosis?
So multiple sclerosis is commonly seen in young ladies.
Hmm. Okay.
That we cannot pinpoint a cause for multiple sclerosis. However, there are some uh, risk factors which can cause multiple sclerosis. But there is no one cause which can be attributed to multiple sclerosis. Some of them are prior viral infections. Okay, mainly Epstein-Barr virus is an infection which has occurred. Then those people are having propensity to develop multiple sclerosis. If you have low vitamin D, they have propensity to cause. If you have low sun exposure, then you have a propensity to cause. So this is what we cannot pinpoint a cause for multiple sclerosis, but these are some of the risk factors, or these are some of the causative factors is what we can say, but it is not definite. And if your family member has multiple sclerosis, first degree family member has multiple sclerosis, then your chance of having multiple sclerosis becomes higher compared to general population. So this is what I can about multiple sclerosis. One word about one aspect about multiple sclerosis is it's a disease which is which is an autoimmune disease. Whenever we use the word autoimmune, it means that our body's immunity is acting against ourselves. So this is a disease which has treatment in the form of decreasing our body's immunity so that our immunity doesn't act against our own cells, mainly nervous system in this particular disease are called multiple sclerosis. So there is treatment for this also. You use type of drugs which will reduce the uh, immunity in your body so that our body doesn't act against our own body is what the whole rationale behind treatment of multiple sclerosis is. So having said that, people who are on medications for multiple sclerosis have propensity to develop infections also. Okay, so this is another aspect about multiple sclerosis, but are coming nowadays. That is a good thing about multiple sclerosis. And people with multiple sclerosis, one thing I would like to tell is do not stop your medications without consulting a doctor. Without consulting a doctor, which we see commonly. People with multiple sclerosis, they leave their medication because of the side effects of the medications, or because they think that the disease is all right. They don't understand the gravity of the disease. Okay, and they think it's all right, so they will leave the medication. Why it becomes important is initially it will be in the form of attacks. Okay, multiple sclerosis comes as attacks. You have one attack in the form of blurring of vision or weakness of legs or tingling in your arms. Then you treat that particular attack, patient becomes all right, and next attack comes if you're not on medication. But if you keep leaving your medications and these attacks keep occurring, at one point of time it becomes a progressive disease where no attacks will no more occur, but attacks will be replaced by a course which is going to be progressive, where the person will become bedbound, unable to walk. At that point of time, you'll have to change the treatment. So that's why taking medications regularly under a neurologist is important when you're having this relapsing remitting type of disease, or when its attacks are coming and getting improving. That time you'll have to make sure that you take medications properly. Okay, so that's how it becomes important to take medications regularly in multiple sclerosis.
Okay. Okay, caregivers of such people need training and counseling, which is lacking in India. And your take on this, like example, Alzheimer's, Parkinson's, even dementia.
That is true. Caregivers, main caregivers will be their close relatives. Yeah,
family.
So we need to teach them some techniques so that their life and the patient's life is at ease. Okay, so patients, when they are going through the disease process, they might sometimes not realize that they're giving a lot of difficulties to the caregivers. So there are techniques to teach that to the caregivers how to cope up with them, and caregivers also can take help of a psychologist if they're having something called as a caregiver burnout. Yeah. Now, with respect to the facilities available for caregivers, I agree with you that the facilities are less. It is not up to date. It's not up to the mark of Western countries, but it needs to be picked up. So there are many organizations, non-profit organizations, which are doing a lot of work on this aspect. So what I prefer to do when I'm practicing is that I take information from the patient's relative, not just treating the patient, and how they are feeling, what are they going through, and I teach them few techniques to deal with the patient, and I also ask them whenever they come for follow-up, how are you feeling, and deal with them also, and give them some techniques to help them improve their mental state. Yeah.
Okay. Is epilepsy curable? And even such people face social stigma.
Yeah. See, epilepsy means person is having seizures. Yeah. Or in or called fits in layman's term. So the medications which we use for epilepsy are all medications which will prevent a person from having fits. Okay, and it is not, these medications are not used to reverse the disease process. Okay, epilepsy basically means that a person is having fits, and why the fits occurs is because the patient's brain is hypersensitive. Okay, hypersensitive, it starts firing, and when it fires, this particular seizures occur. So the medications which are used is mainly to reduce the firing. Okay, the firing can occur because of many conditions. It could be because of granuloma, called as a neurocystic sarcosis, where there is a small uh, infectious particle in the brain that can also cause fits, or there is a stroke which can cause fits. Yeah, or there is a tumor in the brain which can cause fits. So medications which are used is only to make sure that that firing is not occurring. We are not tackling the primary disease process here for the medications from medications point of view. There are situations where we do not find any kind of abnormality in the brain, but the patient has fits. So in that case, we are giving medications only to make sure the firing, abnormal firing in the brain does not occur, and it is not to reverse the disease process. Okay, all right. So I would not say epilepsy is curable. I would say epilepsy is manageable, and definitely there is a stigma. So stigma is that from mainly from females' point of view, they do not want to disclose it to the person they're going to get married to, which I would say is completely wrong. It causes more problem. It causes more problem later on if you have not disclosed. So there is stigma. There is stigma around it. So we are trying to make sure that we break that stigma and spread awareness about epilepsy. Yeah, so this is how we can tackle it. When I talk to a patient with epilepsy, if it's a lady, I make sure that I tell the relative or the mother or father that you have to disclose this to your fiance or whomever they're going to get married to. So yeah, it is about the neurologist perspective to make sure the awareness is given, awareness is spread amongst the public.
Okay. And if a person has an attack like epilepsy, you said fits and all, the moment it happens, what should the family members do with the affected person? Immediately, what they do?
First thing is not to panic.
Yeah.
Okay. The fits will come and it will subside. All right. So what they have to do is put the patient on the floor and make him lie down in the lateral position. First thing is that. And make sure that there are no pointed objects around the person. Okay. And don't put anything inside the person's mouth, or don't try to put your hand inside the patient's mouth to pull the tongue out so that he doesn't swallow his saliva. All that should not be done. And you wait. Don't do anything. Don't rub the patient's hand, legs, nothing to be done. Just wait. It will settle down. Okay.
Okay.
And once it settles, keep the patient in that same position for at least 10 to 15 minutes. Then gradually the patient will recover. Okay. And you can take him to the hospital. All right. And there are medications which also you can give when the attack is happening. Okay. There's a nasal spray which can be given. We usually do this in children who have epilepsy. So that also can be done. Otherwise, if we are seeing a patient in a social place, then the person is having epilepsy. This is what you need to do.
So migraine is another common issue, especially with women. Please tell us how it can be managed.
As you asked, migraine is a type of headache which occurs predominantly in ladies, and it is a one-sided headache usually. Okay, and whenever the headache starts, they might have some amount of aura. So aura, which means to say that they will have some blurring of vision, or they'll have tingling sensation on one side of the body. Not everyone. Some of them will have this. This is called as migraine with aura, and the aura settles and the headache begins. And headache will gradually increase in severity over the period of time, and typically lasts for 12 hours to 24 hours. And it commonly occurs in ladies, and it occurs just before or during their menstrual period. This is a type of headache which we are discussing right now. And one of the main therapy for this migraine is that we give a tablet which which is given when the headache starts or when the aura begins, and you're supposed to take it and not wait till the headache becomes severe. That is one way of treating migraine. Another way of treating is if these attacks are three or more than three in a month for last 3 months, then we give regular daily medications which needs to be taken so that the headache frequency comes down, and this is done for a course of 6 months to 12 months. During these period, we advise the patients to do yoga, which has been found to have significant effect on reducing the attacks, and also regular exercises. And these people will have some triggers. Migraine will have some trigger factors. One of the common triggers is exposure to bright light or lack of uh, having adequate food at the right time can trigger a migraine, or lack of sleep can trigger a migraine. So we have asked them to avoid those triggers, and if at all we have decided to put a patient on regular medications, or what I told as prophylactic medications, then we ask them to do a headache diary, where the person has to record the headaches, date on which it occurred, and also the duration and what triggered the migraine. So we get an idea of, when we look at the diary with these recordings, we get an idea of what triggered it and how is the treatment effectiveness. So this is how we go about. Migraine is one of the neurological disorders which is uh, easier to treat, and also it is good for patients compared to other neurological disorders which are which are little more disheartening compared to migraine, is what I would like to say.
Okay. And is weakness of nerves and muscles an indicator of paralysis?
See, weakness is can be classified whether it is generalized, or whether it is one-sided, or whether it is localized to one particular part of the limb. This is how I would like to consider weakness as, or whether it is applied to one side of the face. So generalized weakness is usually because of iron deficiency anemia, or it could be because of vitamin B12 deficiency, or it could be because of any multivitamin deficiency also. So in that case, we do not consider it as weakness because of neurological problem or nerves or muscles. Whenever there is weakness for a patient, it's a symptom. So the weakness can be because of damage to the muscle because of any disease process, or damage to the nerve, which is coming either from the brain or from the spinal cord. So I would not like to say that weakness is always because of nerves or muscle problem. It can be because of deficiency of multivitamins, deficiency of iron, also can cause weakness, which will be generalized weakness. So that's how I would like to put this.
Okay. Okay. And what are
Okay.
the other common problems with which a patient comes to a neurologist?
Apart from what we have discussed,
Yes.
one would be a tingling and numbness in the legs. And if the patient is a diabetic, then it could be most likely because of diabetes, which has caused damage in the legs, in the nerves in the legs, called as diabetic peripheral neuropathy. That is one, apart from what we have discussed already. And other than that, another one is something called as motor neuron disease, where a person will come with weakness of one-sided body or one limb only, and it then eventually it progresses over the period of time to involve all of the limbs and the muscles in the for swallowing and also for speaking. So this is a called as motor neuron disease, which is a type of neurodegenerative disease. So these are the two diseases or symptoms which a person can come to a neurologist, other than what we have discussed already. There are many small
Yes.
rare things which they come with, but symptoms will be more or less what we have discussed, and diseases are these two, which apart from what we have discussed.
Okay. Thank you so much, Doctor, for your valuable insights on so many issues. And thank you for giving
Yeah,
us time.
you're welcome, and thank you for having me on your show. Thank you.
Okay.
Thank you so much.
Okay.